TRT Hormone Optimization Group. Today is the second installment of the pt141, aka Bremelanotide peptide talk. I'll go in. Last week, gave you a brief background on pt141, what it does. Today, I want to go over possible adverse effects and dosing strategies, okay?
TRT and Hormone Optimization channel. I was on the channel before, so I've been following the channel, watching it every now and then, so be sure to check them out.
Consider subscribing, hit that notification bell, and you'll be on your way.
So the first adverse effect that is a possible consequence of using this is hyperpigmentation. In other words, it can cause you to have a tan. Your skin can get darker as a result of using this peptide. So to minimize the incidence of this occurring, I suggest that most patients limit its use to roughly 7 to 8 times a month or less. Since pt141 does hit 2 of the 5 melanocortin receptors, hyperpigmentation incidence is less likely than if it were a non-specific melanocortin receptor agonist and hits all 5 of them. This one hits 2, but it's still a possible adverse effect and a possible consequence of using this medication. If hyperpigmentation does occur, then back off in terms of dosing frequency and or the number of milligrams that you are using. Once again, I tell patients typically limit it to roughly 7 to 8 times a month or less in terms of the usage. Another possible side effect is that pt141 could increase your blood pressure. The literature shows that on average, it increases blood pressure by about systolic, by about 5 to 6 points. On the other hand, it can also possibly lower your blood pressure, roughly about 5 beats per minute. So for patients that have uncontrolled hypertension, pt141 is considered a contraindication to that. Now, if you do have hypertension and it's controlled, then you just use caution and be prudent when using pt141. Now, it's speculated that the rise in blood pressure is secondary due to pt141 increasing the reuptake of aldosterone, which can promote the reuptake of water and sodium. So most likely the blood pressure is due to water retention, but that's just speculation according to some of the literature that's out there. Also, if a patient is on rate control drugs such as a beta blocker or a calcium channel blocker, once again, caution should be observed, but it's not necessarily an absolute contraindication. The third big side effect that seems to be the most bothersome is nausea, and it actually occurs in roughly 40% of the patients. That is a lot of patients. Nausea is primarily caused by delayed gastric emptying. In other words, food just ain't moving like it used to. Think of it this way. Think of the food in your gut as interstate traffic, 6 a.m. rush hour, okay? If you throw more food in there and the traffic ain't moving, it's all just kind of backing up. So that's why people tend to have nausea along with indigestion, dyspepsia, aka worsening of acid reflux. Best bet, take it on an empty stomach, wait at least 90 to 120 minutes prior to administering this medication after your most recent meal, okay? Lastly, with regards to dosage, men should start roughly 1 milligram sub-Q injection 30 minutes to 6 hours. Yes, that's a large window, so it gives more flexibility. 30 minutes to 6 hours prior to the anticipated sexual activity time. Women, on their hand, they start the 2 milligram dose 30 minutes to 6 hours prior to anticipated sexual activity. However, regardless of gender, 2 milligrams seems to be the upper limit, and therefore you should not exceed that. I appreciate you guys tuning in tonight.
Consider becoming a channel member for exclusive features, like loyalty badges, early access to new videos, funny stuff like rough cuts and bloopers, members only photos and status updates on the community tab, and members only livestream chat. On desktop, use the join button next to the subscribe. On mobile, use the join link in the description. Alright guys, well, do this next, click on one of these thumbnails to learn a ton more about TRT and hormone optimization. Thanks.